E te whare, tēnā koutou katoa. Ko te wāhi kiau, he tautoku ngā kōrero. O te karakia inia, tēnā koe, te tuku ngai ngā whakamoemiti ki te wāhi ngaro. Ka mutu ki a tātou katoa kua hui mai tēnei rā. Tēnei te kawe mai, ngā mate kai runga iau, te arawa. Kia tangi hea tātou i tēnei rā. Ke tai ai te ki, waiho rātou ki oki oki. Nei tātou, te hungora, huri noa, tēnā koutou, kia ora tātou katoa. Can I thank Inia for giving our karakia this morning? I'll just translate what I just said for those who didn't know. I bring with me those who have passed on amongst my tribe in the last couple of weeks, and indeed te ao Māori, and as we do, lay them in front of all of us so that we can all pay our respects and weep over them. We need to let them go where they need to go and focus on the living. So thank you very much for the opportunity to be here. Kia ora tātou katoa. Can I acknowledge the NGO Council and the Ministry of Health for the forum, and indeed the forum organisers, all of you. To Donna, I understand that she's tied up with whānau issues, so I'll just acknowledge her, but I did see her at the beginning of the week. To Jackie for your welcome, Fran for being an awesome MC already. I might grab you for the Māori Party Council National Hui. Also to Chai, tēnā koe. And to all of you, representatives of our country's NGOs and perhaps the government departments. Yesterday I was at a hui of all the social sector providers in Whangarei in the north. And I think I want to start by just acknowledging all the mahi that you do throughout our country. It's all very well to come up here and tell you how you should be doing it, but actually you're the main ones. You're the ones that do this stuff day in, day out. I just want to acknowledge the work that you do for our people, wherever you might be throughout the country, and say, kanui te mihi kia koutou katoa. I'm obviously, I'm Minister for Māori Development, a Minister for Whanau Ora, and Associate Minister for Economic Development. My understanding of health issues is limited to my daughter's student loan, who went to be a doctor, went and spent 7 years paying a student loan to be a doctor, then decided she didn't want to do that and went overseas to be a nanny in England. So that's the closest I get, but the good news is she arrives back today and is in the country this morning, having had her OE in London. The downside is that she might be a doctor, but when I got my aches and pains and say to her, can you fix this, can you give me a rub here, she says, go to the doctors. Anybody who trained those doctors of this generation needs to get some things sorted out, because they need to look after their family first. Anyway, he oma, as a good teacher, I am a teacher, I think I better tell you what I'm supposed to try and do for you. I believe that the purpose of the hui is to build connections between the health and disability NGOs, DHB's Ministry of Health staff to strengthen productive working relationships. I need to focus on measurement, evaluation and outcomes. I need to offer some guidance on how NGOs can do this effectively to demonstrate results to funders and stakeholders. I've been asked to set the context for the day, no pressure, around these issues, like getting results. And I think I need to use Whanau Ora and the experiences of Whanau Ora and the challenges and learnings. I have to discuss the importance of government-funded providers, undertaking political and public sector environment, understanding political and public sector environment as a key to knowing what outcomes are expected in 10 minutes. So let's talk about the political environment first, and I reckon I can cut this out pretty quickly. So this is how you do it. If you know the answer to this question, you put your hand up like that. This means you don't know. This means I'm thinking about it. This means I don't really know what I'm doing here. So here's the first question. Of all the people in the room to help us with the political environment, those who know how many people are in Parliament, those who are members of Parliament, if you know the number of members of Parliament, your Parliament in this country right now, today, put your hand up. Remember what the rules are? So I reckon when I look around, hold on, some are sort of coming like that. You either know it or you don't. So let's try again. Those who know the numbers of members of Parliament in your country right now, hands up. Oh, that's not too bad. I bet you're all government agents. Anyway, that's good. That's pretty good for this sort of audience, about 25%. If you know that, then you must also know the numbers of members that are needed to become the government of the day. To become the government of the day. If you know the answer to that question, put your hand up. Some of those people who knew the numbers of members don't know what you need to be government. But anyway, that's right. About the same number, a quarter. Okay, the next question is, how many people know, I know this is not a political speech, so I sort of try and bridge the gap. How many people know, we know that National is the government, how many seats in Parliament do they have right now? Hands up. Now that's better. So that's only about, Jingers, that's about an eighth. That's about an eighth. How many people know how many members are for the Māori Party in Parliament? Hands up. Oh, that's better, thank goodness. So, I'll give you the answers to help you, because this is important in understanding the political environment. There's one, this is for your Google and your iPads and stuff. There are 121 members of Parliament right now. 121. In order to be government of the day, you need 61. Clearly, half plus one. National has 60 wrong, beep. 59 is right, 59 members of Parliament. So if you need 61 to be the government and you got 59, you're short. So the Prime Minister recognises under MMP that you have to get some mates. So he went and saw somebody in Epsom and he said, bro, oh no, he didn't say that. He said, can you come and help me, Mr. Seymour? Mr. Seymour says, yeah, I'll be there, that's 61. And he went to Ohariu and he said, Peter, would you like to be with me? Peter says, hell yeah. There's 61. There's the government. But the Prime Minister thought, now I need some insurance policy and I need to make sure that I can maintain 61 for stable government. So he said, where can I find some stunningly good-looking, sharp, intelligent, brainy people? The Māori Party. And so that's how we get there. And we have a relationship with the National Party that allows me to do, and my mate Marama, a couple of things. One, we must support the budget. If you can't support the budget, you can't run the country. That's number one job. And number two, that we have a bit of an agreement called a agree to disagree agreement, which means that we don't have to vote with the government, so we can vote against them any point in time. But we must vote for the budget. Thirdly, we have a no surprises clause that says, don't surprise the national government. And if we're going to do something, we're going to tell them about it. So that's cool. I just yelled down the corridor to the Prime Minister. And so we disagree with you, Prime Minister, we're voting against you. He says, that's all right, I got the numbers. Fourth thing that we can do is get some policy gains. So the policy gains that we've been able to put our hand on are whānau ora, which I'm going to talk about shortly. And also the lifting of the age for children and parents to go to the doctor and get medicine. That came out of agreement from the Māori Party. And most recently, the lifting of the benefits. So we say we were responsible for that. We know that, and we believe in it, because for 43 years, neither National nor Labour did it. And we pressed through Tariana Turi and my predecessor, pressed for a ministerial inquiry into issues of poverty, and that's the outcome. So that's what we get. The other parts are, of course, that we can move policy. We get some dollars. We negotiate hard to get some dollars to support those programs. And the last part is I get to be a minister. The downside is it may only be for 3 years, but that's an aside. So that's the political environment. And the great thing I tell you that is about, because in the 10 years I've been in Parliament, I've been a minister for 1 year, and the step between a member of Parliament and a minister is huge. It's huge learnings that I never ever dreamed about, and I'm still learning 1 year in the job. But it's a great privilege to be sitting next to other ministers making decisions about, sometimes you might say it's not a privilege, you're dummies, but it's a great privilege to be sitting next to ministers making decisions about how our country moves forward. And so I take that seriously. It's a huge honour and it's a privilege to be able to do that. So I come here, as I say, under that banner, a huge privilege and honour to speak to any people throughout our country about the things that affect our people. So that's the political climate. I hope that you'll tick that off and say he did that. But our influence is, and I suppose I thought, why would you want a minister for Māori development, for whānau ora, to come to this particular conference? And you might say there's no hook. Actually, there is a huge hook. Why? Because the theory will be that we should be working together in terms of whānau ora and those in the health sector. And on a weekly basis in the ministerial meetings, it is a constant challenge to ask this government, and any government in fact, to change their view about how they believe we should interact with families throughout this country. And I want to expand on that this morning. So those are the things that I wanted to sort of start off with and say, as I say, if I can make 2 points just on the political environment. One thing I'm absolutely clear about is this, is if you're in the government, you get everything. If you're in opposition, you get zip. You might have the best ideas, you might have the best heart, you might want to do this, that, and the other thing. At the end of the day, politics is a cruel, cruel business, which is why it's hard fought over. That's why elections are so hard fought over. And you don't win. In our case, there's 2 of us, 59. We aren't going to win everything, but it is by negotiation, and MMP demands that happens. So that's how basically I get here. Albeit 2 people, 2 members, highly intelligent, bring intellectual grunt to the to the government. And I hope bring a Māori view to the government, which is important as well. So I can also say, and just in closing on that part, one thing I'm absolutely clear about is being involved in a fair number of ministerial committees. There is a huge desire on the part of ministers of this government, and I don't say this lightly, I say this seriously, to drill down and really start to make a difference. And I'm clear that when Minister English comes along this afternoon, I would suspect that he would say that the time of just throwing more money into the scenario is over. But why? Because there is enough. We need to change the system, because if it's still, in some cases, because if we're still getting the same outcomes, then more money will not achieve it. We have to look at things in far different way. So the timing of your invitation is pretty apt for me to be here, coming as it does during a period of intense interest regarding the measurement and evaluation of whānau ora. I told you I'd get there. Measurement and evaluation of whānau ora. So let me just start at the very beginning and describe what whānau ora is as best I can. Whānau, families, ora, a state of well-being. Whānau ora is an innovative, strength-based approach to supporting whānau and families. Whānau ora embodies the understanding that whānau give individuals strength and resilience, and empowering whānau as a whole leads to better outcomes for the individuals of that whānau. Given this an innovative approach, it's important to ensure that the outcomes achieved for whānau and families through whānau ora are measured and evaluated in a robust way. And if it's one sort of matter of curiosity for me, it is that I reckon that whānau ora is probably the most evaluated, one of the programs that's under most scrutiny ever in my time. But that comes with the turf. So you'd understand that in the last 3 months or so, excuse me, 3 months there have been at least 3 reports issued, of which whānau ora has been a part of. One done by the Productivity Commission, one done by the Auditor General, and another one done by Te Puni Kōkiri, which has been internally evaluated. And I'm hoping that Te Puni Kōkiri will have copies of that report available for you today to have a look at it. And it sort of builds on the quarter that I have for you. Maintaining the confidence of the public and the government is hugely important, as you'd understand. The challenge of measuring and evaluating whānau ora stems from the underlying philosophy that whānau and families should be the ones in the driver's seat. We say that because no 2 whānau are the same. The challenges faced by whānau and the strengths that they need to draw from to face these challenges are different for each whānau. This can represent a huge challenge in establishing a single set of whānau ora outcomes that each whānau will work towards. Now, following the establishment of the 3 whānau ora commissioning agencies in mid-2014, it remains important that the outcomes achieved by whānau ora are measured and evaluated in a robust way. The first 4 years of whānau ora, up to around 2014, focused on developing provider capability to adopt a whānau ora approach. The second phase of whānau ora focuses on the whānau ora commissioning agencies investing in initiatives to provide direct support for whānau and families to boost their capability for positive change. I know that you have a couple of guest speakers today, Helen Lay from Te Pūtahitanga of Te Waipounamu and Debbie Sorensen from Pacifica Futures. They'll speak a little bit more about that in the program today, so I'll leave all that. In the first phase of whānau ora, our measurement and evaluation activity focused on action research, the collection of whānau survey data and reporting by provider collectives. The results of this activity have been summarised in the report called Understanding Whānau-Centred Approaches, and it was released this week. As I say, there'll be copies available for you today if you want to have a look at them. Now, this report involved surveys of 90 whānau representing some 500 family members. Phase 1 was characterised by 3 major research questions. The first question was concerned with the whānau-centred model. It wanted to know whether contributing services had been able to adapt practice methods that embraced an approach where whānau were always at the centre of an intervention and where whānau aspirations shaped the goal. The whānau-centred approach was significantly different from most social policy programs that, for the most part, had focused on individuals. Whānau implications tended to be an amalgamation of the findings from interventions with individuals. The second research question wanted to know how collaboration between service providers had been achieved and whether the collaboration was positive. Whanau Ora had recommended a delivery system that avoided fragmentation and led to a cohesive and comprehensive approach that cut across sectorial boundaries and disciplinary allegiances. It required alliances between NGOs and other services that previously had worked independently and often were in competition. The third question was about collaboration between social policy ministries. In order to deliver integrated services and make collective contributions to Whanau Ora, government ministries would need to work in a collaborative manner, not easy. The Ministries of Health, Social Development and Māori Development were the core group. The most challenging operational aim was to have integrated contracts that reflected the responsibilities of the various ministries and were guided by an agenda based on whānau at the centre. The report showed that in all three areas there was progress that enabled Whanau Ora to be implemented. First, the whānau at the centre philosophy became a reality for almost all provider groups. Navigators undoubtedly assisted the process. They were able to have a dedicated focus on the whānau as a whole and act as sort of the go-betweens with the various teams within the collectives. A whānau-centred approach was further supported by encouraging whānau to develop their own plans, a new initiative for some. The plans included the resolution of pressing matters as well as longer-term economic, cultural and social goals. Second, collaboration between providers led to 34 collectives being approved in the first 4 years, accounting for 180 provider organisations. Provider collectives were generally able to work cooperatively and reported being enriched by the contributions from each other, and in a space that previously they had been more competitors rather than collaborators. Collaboration between provider groups required the development of a shared vision, the whānau-centred approach, a shared agenda for action and governance and management that supported the alliance without individual groups losing their own identity. In the third area, collaboration between government ministries was, as you might expect, a little bit more complex. Although integrated contracts were developed between the three major agencies, essentially the new contracts were more of an amalgamation of former contracts rather than a contract that was whānau-centred. The report shows the substantial gains for whānau have been made by Whanau Ora. That of course was always the main point of the exercise, that whānau should benefit across a wide range of areas. Now, two types of gains were evident: more immediate gains and those that could be observed over a longer period of time. Together, they demonstrate a progressive outcome continuum built up upon a series of stepping stones that leads all in the same direction. More immediate gains included better access to services, improved safety, increased motivation for change, improved parenting skills, a greater appreciation of tikanga Māori, and a resolution of various crises. Active involvement in whānau planning was also frequently reported. The plans reflected whānau aspirations and goals, whānau priorities, and provided a whānau-centred agenda for change. Now, over the 4-year period, some longer-term gains were also apparent: greater participation in education, better housing, improved nutrition, re-employment, and higher household incomes. In addition, there is published data from DHBs and PHOs which indicate significant gains in health for whānau who are involved with Whanau Ora providers. So in summary, e hoa, the research shows that Phase 1 of Whanau Ora has far exceeded expectations. Change to service delivery coupled with increased whānau autonomy and capability, have laid strong foundations that we hope will speed up phase 2. The second phase of whānau ora has involved a focus on measuring and evaluating the outcomes achieved via a new way called commissioning agencies and an investment model in whānau ora. The measurement and evaluation involves analysis of commissioning agency progress information reported against the priorities and objectives included within their annual investment plans. This analysis is summarised for a range of audiences and stakeholders. Te Puni Kōkiri is currently developing an updated measurement framework for the second phase of whānau ora, and the importance of measurement and evaluation within the second phase of whānau ora is something that's been picked up by the Productivity Commission's report, and the name of that report is More Effective Social Services. This report highlights the significant potential whānau ora has as a devolved method of social service provision to achieve meaningful outcomes for whānau and families in need. The report also notes that better dissemination of results excuse me, achieved through whānau ora is necessary to maintain public confidence in whānau ora. The wider public commentary on whānau ora also demonstrates the importance of providing a robust evidence base for achievement of whānau ora outcomes. Demonstrating this evidence base relies on the efforts of those closest to whānau, those navigators, those providers working with whānau and families to provide the support and assistance that they need. It is absolutely crucial that these individuals keep comprehensive and accurate records of the gains for whānau and families as a result of those interventions, and that these records are made available to whānau ora commissioning agencies and provider collectives. I want to sort of wrap up now with just some final thoughts about this kaupapa that we're talking about. Measurement, evaluation and outcome approaches based on strengths rather than deficits encourages greater participation by those who are less likely to engage. Outcomes that are strength-based are more likely to provide insights into solutions and ways of providing support to those in need and to those who aspire to a better quality of life. Outcomes that are less tangible but encourage motivation, build trust and gain confidence must be recognised as valid incremental steps towards loftier outcomes. There is a need to ensure that the involvement of the research participants are included in planning, research and evaluation so that their voice is absolutely explicit. So the learnings from the report Understanding Whānau-Centred Approaches have, I think, highlighted the need to focus on strengths and culturally grounded measures based on aspirations and not just needs. A major challenge in this research was the ability to demonstrate results that made significant improvement for whānau in a short time frame. Research and evaluation approaches must consider the complexity of issues for Māori, which have a considerable impact on the extent of expected change. Research and evaluation approaches must therefore include time to plan with Māori, to build relationships, validate the incremental changes towards higher level outcomes, and be clear about what is actually being researched and why. So, in closing, can I say, as a minister and as a member of the government at this point in time able to make decisions, I for one am focused on results. I expect that those under my purview will deliver results. The opportunity to make change for our country and for our people may only come around every 3 years. Therefore, you've got to make sure that you deliver in that time. I'm committed to doing that, and I know that other ministers as well are very much looking at the issues that we've just talked about today and achieving that outcome. Sometimes you might not believe it, but I can tell you that certainly from the work that I've been doing with other ministries, other colleagues as well, that everybody is committed to do that. The difficulty is how to do it and how to make change, both not just for the here and now, but for the future. Thank you very much for the opportunity to be here. I hope that's been helpful, and really looking forward to hearing some of the outcomes of the hui. Tēnā koutou, kia ora tātou katoa.